Welcome to Adapt NCLEX, and thank you for deciding to watch this video. If you're watching this video, I know you're looking for strategies to pass your NCLEX. I've been asked multiple times and I've resisted to make this video because I don't have a magic bullet. But there's certain things you have to know when you answer questions. I've taken multiple board exams and that's what I use. That's how I study. If you want to learn how to answer NCLEX questions, stick around. I'll show you. It may help you. It may not. You may already have your own strategy, but this is what, based on the request, this is what I have for you guys. Maybe it will help you somebody. But before that, I want you to watch carefully what I'm going to do. This is a question. See what I'm going to do. What is the next first action? We don't even start from the top, from the bottom. And I know what I'm supposed to do. First action. That means I have to take an action. What I'm being asked to do is take an action. Therefore, do something. You, the nurse, don't call the doctor. Don't let anybody do anything. Your first action. Then what is the case? So I know what I'm being asked for. What is the situation? A client presents to the PCP clinic with complaint of what? Weight gain despite what? Exercising 3 times a day. She feels tired all the time. She report excessive what? Straining. You see what I'm doing? Circling keywords, buzzwords. She had to wear multiple clothes during the winter. Keyword. And menses are irregular. I've read the case and I know what it is. And I have underlined all the buzzwords in the case. I have a client who has gained weight, is tired all the time, straining, that is constipation. They don't tell you, but they put in the words. Wear multiple clothing during the winter, cold intolerance, amenorrhea, menses are irregular. Those are our keywords telling me I need to worry about this patient. Those are my buzzwords. So I have my ask, case, and the buzzwords, and I rewrite it the way I want to so that I can understand. I simplify this long, so I'll tell myself, a client who is tired, gaining weight, cold intolerance, and menses are irregular. It sounds like something I know. And my content is what I used to rewrite. This tell me this patient is somewhat hypothyroid. Is showing signs and symptoms of hypothyroidism. That's my top on my differential. Based on the information given, this is what I think the problem is. So I know what kind of answer I'm looking for. I'm not even looking at the answer choices. I've done this 10 seconds to analyze the question, broke it down, and I said, this is an hypothyroidism problem. And I know what answer I should be looking for. So, and I know what I'm being asked, right? So then you make a decision, okay? You select something and make a decision. First action. Do I evaluate for depression? I'm giving the patient another diagnosis. Evaluation is not an action. You're trying to get more information. Do I need any more information for this particular question that is being given? I don't need any more information. I may need to evaluate it later on, but I need to take action. If I don't get an answer, then I can evaluate for other problems. I've been given enough problems to tell me this is hypothyroid. Would I start medication? I have to make a diagnosis. It's not enough. Check TSH. Yes, this will confirm my suspicion that is hypothyroidism. It's confirming, helping me. I don't need to evaluate the patient, and now I need to do a confirmatory test. Treatment is taken to a lab. You suspect that, you don't treat it, you confirm it. Here, I'm letting somebody do my job. He said, first action. The next first action. That's your buzzword. You doing something. You see what I've done? And that is what you should be doing when you're taking a question in the NCLEX. There's nothing to it. Take your time, break the question down to the sense that you understand. And you see that the keywords will be popping. I call them buzzwords. They pop at you as I've underlined. And that lead you to make a diagnosis and take care of the patient. So our right answer is check TSH. You have to rule out hypothyroid problem for every most psychotic problem, especially depression. So that's why you get to check TSH. If you look like depression, you have to check TSH to rule out hypothyroidism to do that. That's what I did. If I'm taking exams, this is what I would have done. Therefore, let's look at my strategy that what I've done, I just put it in words now. I'm going to put it in words. The key to answer your question is number one, you have to, what do? You have to think like the examiner. This is loaded. This is loaded. How do you think like examiner A know how they write questions? And two, B, how they position or use words in the question. So that's number one. How do you have to think like the examiner, and then you have to know how you thinking like examiner is how they write a question and how they position or use words in the question. A, you have to know how do you know how they write a question? Know what are the components of the question. They can't write the question without giving you the client information, right? They have to give you information of the client. They can't write a question without telling you what the problem the client had. Like I told you, the client presented to the emergency room with what? Fatigue, weight gain. So the problems, they have to give you the problems of the patient. Every question has to look like that, right? And then they have to, the problem the patient present with, they have to give you clues on which are called buzzwords. But you have to figure out, they hide the buzzwords. They can put it in the sentence form, and these are usually hidden, okay, in the question, and you have to go fish for them. They give you client information, okay? They give you the problem the client is suffering about. They put the buzzwords to describe the problem, okay? Buzzwords to describe the problem, and they have to tell you what you should do, what you should do. So what does that mean? That means, did you have to take an action? Is it a priority problem? Did you have to do a select or apply? Did you have to like intervene in the patient, right? Do you have to provide some teaching? Okay, you have to provide education, which is the SATA, right? All these things they have to tell you. That is part A. The part B, we thinking like the examiner. That's the first one, okay? Thinking like the examiner. So this is the question. You are not even answering. You're breaking down the question. I'm going to take my time and show you all the detail. Then B, after you know how they write the question, you have to go and get it. So how they position or use the word in the sentence, how did they do that? You have to go get them, right? You go. That's why I read the last portion of the question. This will give you the acts of the case. Okay, what's the acts of the question? That's the acts. Then you read, after you read the last portion, you know what you are going to do. Then rest of the case is the beginning of the paragraph. You read it. When you read it, that will tell you what is the problem. So that's how they position. And when you're reading it, you see that the buzzwords will be coming. You can see it in the middle. The buzzwords are in the middle of the questions. Okay, the case is basically like putting you in the setting of the problem, and then the buzzwords start coming in the middle. Okay, and the buzzwords sometimes include the problems. That's what the problems are. Those are the problems, portion of the problems. Okay, and then you can see that when you know what you're being asked and you read the case and you see the buzzwords, you're done. You just have to rewrite them and then answer the question. So that's the first clue. This is just looking at the question, analyzing the question itself. I've not even looked at the answer choice. I've not done anything. This is your key. The time you spend to do this, you see that when you answer the question, it's straightforward. You don't have to do anything. You don't have to do anything. That's all, because I will know what I'm being asked, the buzzwords, and the case, and then I can pick the answer choice. When I rewrite my answer choice, I know what I'm looking for using my content. Now, then go look for the answer. That's number 2, right? Go look strategy number 2. But these are sub strategy. How do you look for the answers? There's key in the answering. When you're looking for answers, you know what you're looking for based on your content, based on your ask, case, buzzwords, rewrite, and then your the selection. In your case selection, you got to do some mental process. So A, bear with me, right? Please answer the question being asked. Don't ask something that make you feel comfortable. If they say take action, like the first question we saw, take action. If they said teach the patient, teach the patient. If they said intervene, please intervene. If you're going to confuse you, write it down. I'm intervene. So every answer that does not intervene is a wrong answer. It's education, educate the patient. That's all. Don't intervene something that you're not supposed to. Keywords, number 1. So, number 2, watch for distractors. I call them distractors. And what are they? They answer the question partially. Partially. So, for example, you're educating the patient about food they're supposed to eat, and they give you multiple answer choice, like somebody with the example like in celiac disease, right? You know they're not supposed to eat certain food, right? So when they give you the answer choice, they mix them so that they mix the wrong answer with the right answer, and then you can figure out, one of them is right, but 3 of them are wrong. So you just have to look at it and say, make sure all the answer choice is right. So that's some of the answer. That's partial answers, right? Partial answers. Those are the one you should worry about. So like I said, partial answer. Like I was using celiac and true. You know that they have to avoid broth, but they can eat rice, corn, and potatoes, right? They can mix the answers, and then you can see 2 answers right, but 1 is wrong. Can give you 3 answers. So you got to watch for those distractors. That's number 3. So partial answers are not right. Don't let them feel comfortable. It make you feel comfortable. Oh, I see 2 answers. It's familiar with me. Don't pick it. Just move on. It's partial answer. Okay? And then don't look for absolute value. I don't look for them because I'm looking for right answer. But when you see an absolute value, yeah, you should not pick an absolute value. There's nothing absolute in medicine. Okay, that means all. When you say all of the problem, yeah, always. It shouldn't be. There's nothing always. You must do this. No, it's so absolute that you cannot You should never do that. It's nothing like that. There's always a room for improvement. So you can do that. That's like too absolute an answer. Don't pick that answer choice. And then the E, A, B, C, D is, I call them bi-directional answer. So when you see something like they give it to you on or off, yeah, one has to be right. It cannot be both, right? Up or down. No, it can't be. Supine or prone. It can be, right? One has to be the right. Increasing or decreasing. Yeah, that's not right. One has to be right. Increasing or decreasing. You see answer choice like that? Or they said the next should continue versus stop. You know one of them have to be right. So go back to the question and see what is being asked, and you'll be able to figure out the answer choice. That's where that is test taking strategy, that you focus on those answers. You said, oh, this has to be one of them, and so that's where my focus will be, and that will help you answer the question easily. Okay, so that's what you look for. So that's number D. E, look for odd answers. What I mean is, if everything is saying the same thing, it said, example is they're not using the right word. They're not using the right word, but they're doing the same thing. Exercise. Let's use example. Exercise 3 times a day. Exercise 4 times a day. Exercise 5 times a day. All of them saying something, or they say increase your activity level. Exercise, increasing activity level, or brisk walking, 30 minutes a day is the same, saying the same thing. But if one of the answers does not, 3 of them saying the same thing, and the other one did not say anything about exercise, yeah, that is the right answer, because all the other 3 saying the same thing, they cannot be right. 3 times, 4 times, and walking breaks, they are the same thing. So why would I pick that answer choice? Don't do that. This is what I like. Do your job. You see the question I did? He said, take action. What is the next first action? I never ask anybody to do that job. I check my lab work. In your test, you are allowed to do that. I mean, you have a permission to do that. Don't say I don't have orders. You have orders for everything. Therefore, do your job. If they want you to get orders, they said anticipated. They used the word anticipated. That means you know what is coming. Okay. The next anticipated action or medication they anticipate will happen. Don't wait because the doctor doesn't give you orders. You're not going to intubate the patient. Well, you should do that. Do your job. I don't mean you will intubate, but you ask for intubation. When you say intubate, that means people who are involved will be doing the intubation. G. This is always the tricky one. There's 2 situations in life. There's emergency, okay, and urgency, right? Emergency means you have no time. There's no need for you to be looking for more information. Patient in distress, treat them. Patient will be showing signs of future distress. That's urgency. That's when you got to figure out what is causing the problem. Figure out what is the source and fix the source before they get sick. Like a patient in the ventilator and is coughing. Yeah, you got to figure out why they're doing that. But if they are in respiratory distress, their SAT is going down, you don't do that anymore. There's no need to find the source. Fix it. If you need to suction them, suction them. So in emergency, you treat. In urgency, you assess the patient and figure out what is going on. That is my key. Urgency, assess the patient and figure out what is going on and see whatever is going on is affecting them. Okay. In emergency, there's no need. Treat the problem. Example I can give you, patient has a chest tube and you go in, okay, and the chest tube came out from the patient chest. Patient has no chest tube anymore for pneumothorax. This is the chest. The chest tube has come out from here, from the patient. If you assess them, you're killing them. There's no need for assessment. This is no urgency anymore. This is what? An emergency. I need to take a sterile gloves and put my hand here and put the gauze and tape it in 3 places. That's what you do. You don't go and listen to the alarm. The chest tube came out, so fix the problem. It's different, okay, if you check in and there is no tideline in the chest tube. You look and there's no tideline at all. And you look at the water seal area, you don't see any tideline. Yeah, that's urgency. Something bad is happening. Why I know tideline? I don't know breathing. Yeah, I go and assess the patient. So my answer choice has to be assessment. Finding the problem. Okay. And then H. When they give you time, it's a factor. Usually I don't look at time for prioritization. But in a single standalone question, time is absolute. Like if they say patient in 2 minutes ago it was fine, and all of a sudden, yeah, they tell you that something has changed in the patient, and they want you to take an action. Time to me is an action phenomenon. You have to take an action, do something to figure out why the patient condition has changed. That's the way I see it. Okay, so that's the way I see it. So time immediately, suddenly, the words they use, suddenly, and immediately something happened. So that telling you, you got to do something about it. You got to do something right away. And then let's go. The I. If it's a SATA form, this is a SATA question. You have to do the same thing. The way I answer SATA question, I'm going to clean. The way I answer SATA question, okay, I do the same thing. I look for what I'm being asked, look at the case, the buzzwords, okay, I rewrite it. And what? Using my content, and I answer the question. I make a choice and I move on. I don't care about anything. But what? Your content is what is going to, if they ask you something about lithium, you know the keywords, you know the buzzwords, you rewrite. Like example, patient on lithium, and which of these statements you should intervene. Okay, you said, patient is on lithium for bipolar, right? I know so my content, this is what I'm doing. 2 seconds, I'm writing content, what I should avoid. Dehydration. And what does dehydration mean? It's the kidney that is the problem. Therefore, anything that affects the kidney, I should intervene right away. So if you have diarrhea, which is a GI problem, that is the number 1 sign of dehydration, I'm I'm intervening. If you don't drink water, yeah, we have a problem. If you're taking hydrochlorothiazide, yeah, we have a problem. All those things, everything, I'm referring back to what? The kidney, the kidney, the kidney. Anything that is going to affect the kidney is my problem. And when you're selecting the answer, nowadays, the new generation is straightforward. What you're looking for is what? Confidence. What is your confidence level for the answer choice you selected? What is your confidence? Don't pick an answer that you are 50-50. No. Now you get a partial credit. So never pick 50-50 answer choice. I want to pick something that I'm 95, that I will get it. And don't guess. No guessing anymore. So if I thought 95 is low, I got to be like 99% sure. Some people will say, unless I'm 100% sure, I'm not picking it. But I'll give you 99% sure, plus or minus error. But if you're not your confidence level is less than 99 or 100, then let it be. Don't pick that answer choice at all. Don't do that. And the last one. Last one is my favorite because it's the bulk of your exams. Prioritization. Prioritization. You have to be sharp. When you answer prioritization question, if you are not sharp, you're going to be wrong. And what is being sharp? B, you're looking for breathing problem. And if you watch my channel, I have a bunch of videos about what is breathing problem. Somebody with a pulmonary embolism, I know this is a breathing problem, right? Somebody with a DVT, I know this is a breathing problem, right? That is a breathing problem. That's what you worry about. Okay. Somebody with pneumothorax, it's a breathing problem. As soon as I hear it, I'm worried that this patient may have a breathing problem, and I need to look at them more than once. That's what it means being sharp. Be sharp means you taking is a combination of diagnosis that you should worry about. When you hear it, somebody with a fat embolism, oh, it's a breathing problem. They're going to get into trouble. So that's what I'm looking for, right? And E, I'm looking for electrolyte. If the patient has electrolyte problem, he's my boy. What electrolyte? Sodium, potassium, magnesium, and calcium. These are the only one I'm worried about. Every time it goes up and high, I'm worried about it. The S, worry about shock and sepsis. Okay, patient will be in sepsis and shock. So hypotension, tachycardia, sepsis. The sepsis, you got to be careful. If they give you abdomen sepsis, just because you have 9 out of 10 abdominal pain is not enough for me. I need to see what? Rigidity, abdominal rigidity. These are buzzwords I'm looking for. I'm looking for rebound tenderness in the question. I'm looking for what? Signs of peritonitis. That's what it is. So rigidity, I'm looking for guarding, okay? The patient is guarding in the abdomen. But 9 out of 10 is not enough for me. Okay, shock can be changing mental status. That's all. Okay, it can just be changing mental status. It can be tachycardia, hypotension, cold extremities, or signs of shock. Okay, they will hide it. Those are buzzwords. Then what? The age, which is always trap people, is hypo hypothermia. Low temperature is a cardiac problem because you go into cardiac arrhythmia. So I'm worried about somebody whose temperature is low than somebody whose temperature is high. And then this hypoglycemia. If your sugar is 500, I don't care. I care about somebody's sugar is 50 rather than 500. So when you see 250, 300 sugar, don't worry about it. You know, in a prioritization patient, who do you see? I will see a 50 finger stick rather than 500. Then the A is my airway. I'm looking for this word, drooling. I'm looking for stridor, okay? And I'm looking for what? Other signs of that somebody who is lethargic, because when you are lethargic, your brain function doesn't work, and your breathing system is in your brain. So drooling, stridor, lethargic, yeah, I'm worried about you. It's a breathing problem. Those are the signs. Okay, somebody is wheezing really badly and then they stop wheezing. Yes. And the R is neurological. Okay, so neurological, number one is lethargic. Anybody who have changing mental status, they can't breathe anymore. They usually can't think. The brain function is affected. They have changing mental status, and then they basically cannot think appropriately. So those are the patients you have to see. And finally, P, which is always trap people, is pain. We all have pain. We all go have pain, go to the emergency room. We want to be taken care of. But not every pain the nurse has chance to take care of. Which pain? Pain that will let you lose your limb, life, so limb, life, and eyesight. What does that mean? If my leg is going to be cut off or my extremities, yeah. So leg extremities like compartment syndrome. Yeah. If you don't take care of it, I'm in trouble. So if you don't take care of it, yeah, I'm going to lose my limb. Right? If somebody have testicular torsion, if you don't take care of it, well, they're going to lose that testicles. That's a limb. Life, if I have chest pain and you don't take care of it, I'm dying. If you have abdominal pain and I have rigidity, I'm going to die. But if you have migraine, headache, you should not worry about it. Migraine headache is not going to kill me. If I have what? Classic example of what? Trigeminal neuralgia with shooting, stabbing, pain in my face. Yeah, you should not see me. You'll use big words, but don't worry about it. And a high side, yeah, somebody who has glaucoma and you give them anticholinergic, they're going to lose their eye. Somebody who have retinal surgery and you put them in the wrong position, they start having pain, they're going to lose their eye. So this is what the BESHARP is. So when you're answering questions on prioritization, you got to be sharp. So in simple terms, how do you select your answers? Watch for your distractors. Okay. Make sure the answer choice is complete. Avoid absolute answers. Okay. Look for the bi-directional answers. That means one of them is right. Okay. Any odd answer among the other ones is the right one. Remember to do your job. And in emergency, take action. In urgency, find the problem, assess the patient. Time is not your friend. Therefore, do something at that time. When you have a SATA question, ask, case, buzzwords, rewrite, use your content, answer the question, pick an answer choice, that you are 99% sure. Don't guess. And you see what prioritization, what you can do. You can do this. This is my strategy. That's the way I answer question, no matter what it is. I go through the same mental process. I think the problem is people don't want to spend the time to go through the mental process. There's a knee-jerk reaction to go pick an answer right away. You should not do that. 50%, I tell my students all the time, or my friends all the time, when we're in school, 50% understanding the question is 50% of the answer. So if I understand what the examiner is asking me, I've already answered the question 50% of the time. Good luck. All the best of luck. And may God be with you. Bye.